Well, good evening, everyone, and welcome to KATV's Roundtable discussion on medical marijuana. I'm Chris May, and I'm here with Roby Brock from our content partner, Talk Business and Politics. We're pleased to be on your laptops and your cell phones here on Facebook. This evening, we're going to break down the two measures that will appear on Arkansas's ballot dealing with medical marijuana. Just a few weeks from now, we will hear from both supporters and opponents, Roby, of those two measures.
That's right. Our guests include Dr. Greg Bledsoe, Arkansas Surgeon General, Dr. Joycelyn Elders, the former U.S. Surgeon General, Kirk Lane, Legislative Representative for the Arkansas Chiefs of Police, and Melissa Fults with Arkansans for Compassionate Care. It's a group supporting issue number 7.
We got a lot to talk about over this next hour or so. We want to examine the health benefits and concerns associated with medical marijuana, as well as the social impacts of it. We'll have combinations of our guests here at the Roundtable for discussions and debate, and we want to hear from you. So if you're on Facebook right now, as we know you are, just ask your questions in the comments section. We have our laptop open. We're ready to hear from you. We want you to be involved, so let us know what you think about this very important issue here in the state of Arkansas. So now, let's begin, Roby, with some of the aspects of both these proposals.
Yeah, I want to break it down for everybody a little bit. Let's begin with issue 6. It is the Arkansas Medical Marijuana Amendment of 2016. It would allow a person to receive an Arkansas doctor's certification that they are suffering from a medical condition allowed for medical marijuana usage. The doctor's certification allows a person to apply with the State Department of Health in order to receive an ID card. And with that card, a person could purchase marijuana for medical purposes at one of the limited dispensaries allowed by the law. Now, in the amendment, there are 17 specified qualifying conditions, such as cancer, glaucoma, HIV/AIDS, hepatitis C, ALS, Crohn's disease, post-traumatic stress disorder, severe arthritis, and Alzheimer's disease, just to name a few. Now, on issue number 7, it is the Arkansas Medical Cannabis Act. It's an initiated act. Like the amendment, it requires the doctor certification, the application for an ID card at the health department, and ability to buy a limited amount at a dispensary. But there are more conditions that are allowed for medical marijuana under the act, including many of the ones that were mentioned in the amendment, but also chronic insomnia, chronic obstructive pulmonary disease, COPD, complex regional pain syndrome, Parkinson's disease, restless leg syndrome, spinal cord injury or disease, and traumatic brain injury. So to talk a little bit more about the concept of medical marijuana and these two differences, Chris is with Melissa Fults and Dr. Joycelyn Elders. Chris?
All right, Roby, thank you very much. And ladies, thank you both so much for being with us tonight. It's good to see you. Good news, we have lots of people who are logged on. They are asking questions as we speak, so we will certainly get to those throughout the night. Melissa, I want to start with you, though. How long have you been working toward this cause, promoting medicinal marijuana?
5 years, five long years.
And what do you make of the changes that you have seen in people's perception of this issue?
It's been amazing. When we started this in 2011, people didn't know a whole lot about it, and unfortunately it's been demonized for so many years. But since then, there's been much more information that's come out. There's been much more documentaries. Dr. Sanjay Gupta has done 3 documentaries that have been amazing, telling about the medical benefits. And I think people have realized in the 25 states that have already passed it that the world didn't come to an end and people got healthier. So I think this time it's going to be a much different results from 2012. We got really close in 2012. We only lost by 1.75%. I think we're going to pass it with flying colors this time because people know that patients need this for medicine, and it truly is a medicine.
Talk more about that. Why do we need this in Arkansas?
Well, number one of the biggest things, one of the biggest problems in our country, not just our state, but in our country, is opiate addiction. And there are so many prescription drugs that cannabis can actually replace, and everybody says, well, why not put it in one little pill? Well, the difference is with the whole plant, with the different strains, you have different levels of CBDs or THC or any of the other components, and depending on the illness, it has a different level of each of those. Like for cancer patients, you need a high THC so that they will increase their appetite, it will decrease their nausea, makes them feel better. But then when you have something like a child with seizure disorder or an ADD, ADHD patient, they need a very high CBD with a very, very minimal amount of THC. But you do still have to have that tiny bit of THC in it in order for it to work. And that is what we need for those patients. Now, with a pain patient, you need kind of an equal amount of THC as well as CBD. So you need all these different strains. You can't get all of those strains in one pill. And one of the main things that the opposition throws out there is, oh, we have Marinol. Well, the only thing about Marinol is it is a synthetic, pure THC. You know, they worry about the 28% that's in, you know, some of the highest levels are 28% in the actual plant. And they're upset about that, yet they have no problem with 100% THC. So that doesn't really, you know, it doesn't really add up. But there are just so many patients that I have seen personally that have responded to cannabis when they did not respond to the typical medications that they give. We've met Crohn's patients that in the first time in their lives, they're in remission. I've actually met cancer patients that are in remission. It wasn't from chemo, it was from the cannabis.
I can't think of anyone who has more experience in public health than you, Dr. Elders. Do you agree with what Melissa's saying? What's your position on medical marijuana for treating patients?
I very much support medical marijuana for treating patients. I've supported it for years, and everybody knows that. One of the things, she was talking about Marinol, one of the things we have to know about Marinol is you have to take it in, and it has to go through the digestive tract, be absorbed into the bloodstream, whereas with the marijuana, usually you can get it into the brain within seconds, and it takes 30 minutes at least. And then if I'm sick and vomiting, I might not be able to keep this pill down. So I think that that's another problem. But I think it's take the interaction of other substances, both the THC and the BBDs, as she mentioned, in order to get the same kind of effect.
Why do you think medical marijuana has taken so long to catch on? As she mentioned, it's now legal in half the countries. But if this is something that you believe is good medicine, why isn't it everywhere at this point?
Well, of course, we have to start out from the very beginning, you know, back in the 1800s, when there was never really good scientific evidence against marijuana, is being classified as a Schedule I drug. You know, it's put into the same category as heroin and peyote and other things. So
and can't be prescribed as a result of that.
Yes, and can't be prescribed as a result of that. So and then we didn't. Nobody wanted to do any research on marijuana. The only place we had that had, you know, where you could get really pure cannabis was really from a laboratory down in Mississippi. And that was fine, except, you know, they put it in and stored it. Well, I think now we're finding out that and we felt that the concentrations that they were able to get and test was really very low, because we know the older the plant, without any plant, the lower the concentrations of THC.
So based on your experience, you're supporting medicinal marijuana. Are you formally supporting Issue 6 or Issue 7? Both? Neither? Are you getting into the politics of this year in Arkansas?
I'm not getting into the politics of this drug. I'm here as a public health person, and I'm here as my opinion as a physician. And, you know, people may differ, and I have no problem with that. But, you know, the reason I'm even more concerned about marijuana is because of, you know, I think our war on drugs and the massive effect that it has had on our young people, you know, in giving them criminal records, being, you know, where they in prison. It's made the United States the world's fattest jailer. We're 5% of the population and 25% of, you know, of the people. You know, of our people in jail. Right. So those are real issues with me. To me, that's a real public health problem.
Let me ask you both about an ad that came out yesterday from opponents to your measure. In the ad, they say that smoking marijuana is not medicine, it's drug abuse. And when I saw that, I thought, you know, this is probably one of the biggest challenges that voters in Arkansas, especially those maybe who are over 35, have to overcome on this. Changing their mindset from associating smoking marijuana with something that is illegal and abusive, and changing that mindset to seeing it as medicine. How do you convince people to do that?
First off, it doesn't have to be smoked. And if you're going to inhale it, we try to encourage people to use a vaporizer. That way you don't get any of the carcinogens. But if you'll notice in that commercial, there was not one single patient in it. There was not anyone in a wheelchair. There was not anyone with cancer. It showed a bunch of kids and smoking marijuana. It had nothing to do with medicine. And this is what we're trying to do, is pass this for a medicine so that people can get the relief that they need and not have to worry about, am I breaking the law? You know, am I going to go to jail? Is my child going to go to the jail because they got me marijuana because I have cancer?
But a lot of people who use marijuana medicinally are smoking it, Dr. Elders. So what do you think about smoking as a way of administering medicine?
I have no... for administering marijuana, smoking is one of the best ways of administering it because it gets to the brain quicker. It gets there, and that's where the neurotransmitters are, and that's where you want to get and see the, you know, get some of the effect. So that, in that respect, the difficulty is you can't measure it. You don't know how much, you know, you can't measure harder to measure the dose. You can't say, well, we gave this many micrograms or less. But, you know, patients learn very quickly how much to, you know, how deeply to inhale.
What works for them.
What works for them. And they do it very quickly. And we have, you know, even with our opioids that we give, we have to figure out what dose to give.
Okay. I thank you both. We're going to go over to Roby right now. We remind you to send in your questions here on Facebook in the comments section. Talk Business and Politics has done a deep survey on this subject and on these two issues in particular. Roby, what do you have?
All right. Well, there has been a lot of polling on this, Chris. Thank you so much. We polled recently two of the issues, and we're actually out in the field tonight polling for the last time before Election Day, the Medical Marijuana Amendment, Issue 6, and the Medical Cannabis Act, Issue number 7. Let's look at what we came up with 3 weeks ago. These were the results from our survey at the time. The Medical Marijuana Amendment had a 49% approval with voters. 43% were against it. So some positive numbers there for the Medical Marijuana Amendment. Only 8% did not know or have an opinion on that. When we go to the Medical Cannabis Act, which is issue number 7, the results were a little bit different. It was 36% for, 53% against, and 11% were undecided. And we've seen in previous polling, one of the positions in the Medical Cannabis Act has a hardship certificate, which allows someone to grow their own plants if they don't live close enough to a dispensary. This has been problematic in some of our other deeper polling on this subject. All of that to say, both of the issues are competitive. We see folks for and against, and it shows in our polling that this is a pretty competitive issue. We're getting all kinds of comments on our Facebook feed right now, Chris. You should not have any problem at all with what you're doing. So I'm going to throw it back over to you. Chris is with Dr. Greg Bledsoe. He's Arkansas's Surgeon General, and he's with Kirk Lane with the police chiefs. And Chris, I'm going to let you take it away. These two guys are opposed.
Yeah, yes, they are, Roby. They have a lot to say. And gentlemen, we appreciate you being with us tonight. Thanks so much. And we do have the questions. They continue to roll in, so keep them coming here throughout the night. Doctor, let me start with you. Medical marijuana is legal in 25 states, half the country at this point. So why not here in Arkansas as well?
Well, I think it's important for voters to understand that there's a difference between marijuana, the plant, and the compounds found within marijuana. I've said from the beginning that I do think that there's medicinal value to the compounds within the plant. But the important thing is that we need to do this in a responsible way. The responsible way is we take the compounds, we isolate them, we purify them, we dose them for patients in a safe way, and that's how we use marijuana as medicine. The other thing that we need to be very clear about is that a lot of people have a general theoretical understanding of marijuana, and they want us to have a general theoretical debate, but we're talking about specific laws that are on the ballot in just a couple weeks. And in my opinion, these laws are written, not very well. I mean, adolescents can get access to marijuana. They're written very broadly. Multiple diagnoses can get it. There's a grow your own provision, And there are provisions in the law that bind landlords and employers, as well as using tax dollars from the sale of marijuana to purchase marijuana for low-income residents. So, when we talk about medical marijuana in the state of Arkansas, we don't need to be giving out the plant. We do need to be researching it. And certainly the specific legislation that's on the ballot is important to look at.
Okay, Kirk, you have come with a bag of gummy bears. I don't think these are for all of us.
Well, actually, I got them for you.
Well, thank you very much. But
go ahead and test one.
I think, though, this is going to maybe illustrate one of the doctor's points, that you're worried that kids might have access to this. First, tell us what it is, and then tell us your concerns.
Well, those are gummy bears, and what we find a lot of times is the packaging or the presentation of what we're seeing in these legalized states and what comes out of these legalized states illegally and goes into states where it's not legal. They could be infused with marijuana. We're seeing statistical and good data from states that are legalized showing 49% increase in emergency room visits by children, and we're concerned about the packaging. And as a police officer in law enforcement, we're sworn to protect and serve and protect the community's safety, and so and especially our children's safety, which is our greatest asset. So again, we are quite concerned as police officers in law enforcement of the packaging and where it's going and how this will affect our state.
What other concerns do you have from a law? That seems to be a safety perspective. What about from a law enforcement perspective?
I think from a law enforcement perspective, and I think Ms. Fults and I, or Mrs. Fults and I, would agree very hardly that opioids and prescription medications are a major problem, not only in Arkansas but around the state. And myself and Dr. Bledsoe have sat on many coalitions that have really made some changes in prescribing practices and numbers and reductions of death because of prescriptions. And Arkansas is doing a great job in that battle, but we've got a long ways to go. Adding this to it is going to inhibit what we have done and take away what we have done. And what we have seen is statistical data, especially a poll that came out in 13 and 14 between 12-year-olds and 17-year-olds, is Arkansas ranks down, used to be number 2 in the country for prescription overdose. We have now dropped to about 18 or 19. All the states that are in front of us, or the majority of the states that are in front of us except for 3, all have either legalized marijuana or medical marijuana aspects. So that tells us what happens is the acceptance and the reduction of values when it comes to that is a concern to us on drug use in general. And so all the work that we have done and all the Arkansans that we have educated, we will have to start all over again, and that concerns us greatly for public safety.
Doctor, what's your reaction to the polling that Roby just showed us that shows issue 6 seemingly within striking distance of becoming law at this point?
Well, I think the interesting thing that I've seen in the polling is that the numbers of popularity for these issues has actually dropped over the last few months. There were older polls that showed them with higher levels of support. And the thing that I've found anecdotally going around the state is that when you walk into a room of people and you say who is in favor of medical marijuana, there's a pretty high percentage of people who will agree with those general terms. When you start talking about the specifics of the laws, those numbers fall precipitously. So our goal is to just educate the voters. We believe that if the voters look at the laws and see what's specifically written into these laws, that they'll come down on our side. And that's why when you look at healthcare leaders across the state, UAMS is against this. Children's Hospital is against this. The Arkansas Medical Society is against this. Arkansas Hospital Association is against this. And I can go on and on. The Arkansas Minority Health Commission is another one. So a number of healthcare organizations that people respect and trust in this state have looked at these laws and said, we can have a general discussion about medical marijuana, but the important thing is the specifics that are written into the laws, and these laws are not good for Arkansas.
We're going to get into the pros and cons throughout the night, but a CBS News poll showed 84% of Americans support the legalization of medical marijuana, and a lot of that support is based on the idea of compassionate care, that this is ultimately an act of compassion for people who are suffering with an illness. Isn't Arkansas a compassionate state? Can't we do better?
Absolutely. We're a very compassionate state. And the fact is that we can write these laws in a way that's responsible and takes care of that narrow group of people that it would actually help. But the problem with these laws is that they're written very broadly. So I don't want 15-year-olds who are diagnosed with ADHD vaping marijuana in school. I don't want kids to have access to this. I don't want diagnoses like insomnia or migraine headaches to qualify for medical marijuana. It's all in the specifics. We're a very compassionate state. Arkansans go out of their way to help their neighbors. But I think when they look at this, they're going to realize that this is going to cause more harm and more suffering on the back end, and they're going to be against it.
We've heard from the LRPD chief, Kenton Buckner. He says that medical marijuana is a Trojan horse for recreational use. Do you not take supporters of medicinal marijuana at their word that this is purely a medical endeavor? Are you worried about recreational use?
Yes, I'm worried about it because that's the trend on what we've seen. And I think sometimes if you follow the money trail and what supports them, that would support that. Second to that, we've seen and seen these states like Colorado and Washington and the places that have legalized marijuana and how they started and how they did. And I think that if somebody was truly compassionate, and I believe a lot of people are compassionate in there, and they truly have it, and Arkansans have a high compassionate rate, and being an Arkansan, I do too. But what we have seen is how this is a stepping stone in there. And we should learn from our mistakes or learn from our challenges, even from those other states. And they have seen, and there has been states that have tight regulations, like Dr. Bledsoe suggested and talked about. And why can't we mimic them? Why are we so broad on these two ballots that we're not putting in those limitations and learning from those mistakes if we're truly compassionate in that matter?
Henry John, who is watching on Facebook, asked the question, why doesn't Arkansas get with a state like Colorado and implement some of the lessons that they've learned?
That's the question we ask.
Okay.
Yeah, I mean, a lot of the feedback I'm getting from medical professionals in Colorado is they wish they hadn't done it. I've talked to legislators who have been in the state Senate and the state House for a while. They go to these legislative conferences and they talk to people who are very progressive in these states who say, if I could vote again, I would vote against these measures because of this Pandora's box that has opened up. The folks on the other side want to have a very narrow discussion about a handful of specific diagnoses that they think can help, with medical marijuana. But when you open this box up, on the back end, there are a lot of problems that don't get discussed, and that's what we're seeing in these other states.
Okay, from a law enforcement perspective, David Benz asked the question, what happens if someone who possesses medical marijuana, presumably who's allowed to, shares their marijuana with another person?
And those are some of the aspects we have. We're looking at if somebody has a medical marijuana card and gets arrested with marijuana, or for some other reason, maybe it might be DUI because of the marijuana, and they go to jail. Where are our jails and our sheriffs going to be when they say they need to medicate themselves and have to bring that into a facility that is sometimes funded by federal funds and allow that person to medicate or refuse to allow that person to medicate? So there's a whole varying issues of legalities, and we have learned that, like I previously stated, from other states that they're going through that could be written into a better perspective than what we have here.
In the event that one or both of these measures passes in a few weeks as voters go to the polls, what then? Do you respect the will of the voters? Do you continue to fight this battle? What happens then?
Well, I mean, of course we're going to respect the will of the voters. That goes without question. But it does worry me. And if you look at the DFNA report that came out today that did the projections on the budget, they're saying that we're going to fall way under budget, and it's not going to cover the cost of this. We live in a time where our healthcare structures are being stretched to the limit. We don't need this at this point in time, and we've got a problem with access to care in our rural communities. We already have a problem with mental health and access for mental health patients, for practitioners who can take care of them. I mean, this is not something that we want to add into the stressors for the healthcare system that we have in Arkansas.
Can I add to that, too? One of the big things for prescription drug abuse that on the battle that we had, and one of the great tools that we have is the Prescription Drug Monitoring Program, also known as the PDMP. That PDMP right now is funded strictly through grants because we can't find the money in the state to run that $300,000 to $500,000 operation. I sit on that board. I know these facts very clear, and we're working very hard to do that. And that tool has been a godsend in reducing deaths, starting to control prescription drug abuse. There's no database or no plan of action on that, and that will affect it. So if we can't find money to do this, then how are we going to find the money to make this work? And the projections are very clear in that. So that is a big factor that I think voters need to take into consideration.
Okay, gentlemen, thank you so much. I can see the opposition off camera. They're chomping at the bit to get back in here. And we're going to let the two sides mix it up when we come back after this pause. We're going to bring supporters and opponents together at this table. They can counter each other's arguments and give you more information. And we invite you to continue sending your questions in to this KATV Roundtable on medical marijuana.
And welcome back to KATV's Roundtable debate on medical marijuana, medical cannabis. I'm Roby Brock with Talk Business and Politics. We've been looking at some of the polling data on medical marijuana, and I want to share a few more statistics with you from our polling it's about 3 weeks old. I'm going to go with the Medical Marijuana Initiative, the Medical Cannabis Act, since Melissa Fults is in studio. The results were somewhat similar in terms of trends, so let's look at how age, race, and political party plays a part in support and opposition. Let's begin with age. We see some very decisive trends in how different age groups either support or oppose medical marijuana. In the under 30 group, those under the age of 30, it had a 58% approval rating to 42% who opposed it. When you get to 30 to 44, that age group, the support falls off tremendously. It still has an advantage there, 44 to 36%. When you get to the 45 to 64 age group, 39% support medical marijuana or medical cannabis, 51% actually oppose. And then as you get to 65 or older, you've got 25% support to 63% opposition. So you see some really definitive trends when it comes to age there. The younger you are, the more supportive. The older you are, the less supportive you are. On race, we see some very distinct trends too. 56% of African Americans support the Medical Cannabis Act, and that number was very similar for the medical marijuana amendment as well. Among Caucasians, it was 34 to 56%. 34% support, 56% oppose. Now, on the medical marijuana amendment, it was actually a lot more even in this age group right here. It was 46 to 46%, so it was an even split. And then when you get to anyone who identifies themselves as not Caucasian, not African American, that would be Latinos or Asians, or perhaps they describe themselves another way, 31% support to 55% when it comes to opposition, when it comes to race. Now, on party identification, we also see some very interesting results here. Democrats, very supportive of medical marijuana, 66% support, 26% opposition among Democratic voters, but self-identified Democratic voters. Among Republican voters, we see an almost opposite trend there, 38% support, 55% oppose. And then among independents, it leans a little bit more towards the opposition side, but it's a lot closer, 44% support, 51% are independent. So I'm going to throw it back to Chris. He's with Dr. Elders. He's with Dr. Bledsoe. And we're going to talk about some of the opposing aspects, the health aspects of medical marijuana.
Roby, really pleased to be joined by two great public health leaders in our state. And again, we thank you both for being here. In the larger public health community, when it comes to the debate over medical marijuana, what is really at the heart of the debate? Is it safety? Is it efficacy? What is it, Dr. Elders?
Well, I'm not sure I would know absolutely. I think that certainly we know that there are certain patients that have definite benefits. As far as safety, we use lots of other drugs that are far more toxic for the patient, more poisonous. The one thing we can say about marijuana, it's never killed anybody that we can document. We look at alcohol. And we look even at tobacco. These are drugs to me that are far more toxic and cause far more deaths. So I don't think we can throw it up as a safety issue.
Dr. Bledsoe?
Well, I think there's a couple of camps when you look at people who are involved in public health. There's two extremes. There's one extreme that says that marijuana has no medicinal value under any circumstances. That's not my position. Obviously, that's not Dr. Elders' position, and that's not the position of the majority of people who are in healthcare. The other extreme is that marijuana is a miracle drug, that it does everything, it cures everything. That's also an extreme position and not something that the majority of healthcare providers are in favor of. In the middle is where most people are. And I've found that when you talk to healthcare professionals and you say medical marijuana in general, a lot of people are in favor of it. The details really matter, and that's why I think that this debate and this forum tonight is so important, because the details, when you talk about the laws, that's where healthcare professionals start to step away from that medical marijuana definition and say, I'm not sure I'm in favor of that. So if you go into a crowd of physicians and you say, hey, are you in favor of medical marijuana? A lot will say yes. And then you say, are you in favor of 15-year-olds with ADHD getting marijuana to vape or to ingest? Not so much. So the specifics really matter, and that's where you start having the divergence.
So you believe that marijuana can ease severe symptoms. If the FDA,
sure.
If the FDA were on board, would you be on board with this as well?
Absolutely. As a matter of fact, there's a pharmaceutical company in Britain, GW Pharmaceuticals, that has produced 2 other marijuana-based pharmaceuticals, Sativex and Epidiolex, and both of these are going to be coming probably through the FDA approval process and approved in the next year or so. And that's how it should be done. We should be squeezing all the medicinal value out of this plant. We should be purifying these compounds, isolating them, and then dosing them appropriately for patients. I don't think any reputable physician or clinician is against that. We want to help our patients. My argument is that when you hand out the plant, that you can't control the dosing, you don't know exactly if it's efficacious or not, if it actually works, and you worry about impurities and whether or not you're giving it for the right diagnosis. So there's so many things that go into that. But using those compounds, isolating them, purifying them, and then giving it to patients, that's the way it should be done. I'm all in favor of that.
Are you worried about that, about the inability to control the dosage, no prescriptions?
I think, we've not done the research on marijuana that we should have done. It's been, we've had it for years. We've known about it, and, because of marijuana, and nobody wanted to do the research. They couldn't get in the purified form, or couldn't get it excuse me, in the form to do the kind of research they wanted to do. So I think now the NIH and the health system is trying to do the kind of research now that we should have done 100 years ago.
Right. So in the absence of that, we find ourselves where we are now. Governor Hutchinson opposes both of the measures that are on the ballot. He said the measures don't lead to good medicine, and he says, quote, we don't vote on cancer cures in our society, and we should not set a new pattern of determining what is good medicine at the ballot box. Dr. Elders, does putting medicine up for a vote give you pause at all?
I really think the best doctor for any patient is the doctor that's looking at that patient and the doctor that makes the decision. But when we're talking about medical marijuana, you're talking about a doctor who has made the decision that this is the best medicine that I have available for my patient. And I think that when we're out there trying to decide what this doctor should order, I think that that's trying to legislate how we practice medicine. Sure, we all wish that we'd done the research. We all wish that we had the better drugs. None of us are proud of some of the drugs that we have for many of the symptoms we have. But I think that what we're doing, making it available for the patients that really need it and whose doctors want to order it, I think that's the best we can do today.
Is this standing between a doctor and their patient?
Well, I don't think so. And I look at this again as the general theoretical debate versus the specifics. I mean, when you look at who has actually endorsed Issue 6 and Issue 7, there aren't very many healthcare professionals. I read out earlier a long list of people who've opposed it. Dr. Elders has not endorsed either of those. To my knowledge, other than Melissa, no candidate for any office in Arkansas has endorsed Issue 6 or Issue 7. So when you look at the specifics, that's what the voters need to look at, the specifics of all that. And I think, when you talk about doctors and their relationship with patients, that's a very sacred bond that you have. But still, the treatments that we're giving our patients should be based on the medical literature. And when you look at the medical literature, it does say that the compounds in certain cases do help. But all these broad diagnoses that are especially in Melissa's issue, there's no medical literature to support those. So a doctor needs to be doing what's best for their patients, absolutely. but those diagnoses and treatments need to be based on the medical research. And certainly, the details matter.
The Democratic Party and their Senate candidate, Conor Eldridge, have endorsed medical marijuana as an issue, not specifically the two issues on the ballot.
And that's a very important distinction. They've both endorsed a responsible medical marijuana plan, but they have not endorsed issue 6 and issue 7, which makes me think that they believe that these aren't responsible.
Okay. I have two experts at the table, so let me ask you some basic health questions that people may have to consider as they think about these measures. Are there any known adverse health effects to medicinal marijuana?
Well, I think my philosophy is that anything that gives you benefit can also cause harm. So with that said, I think that the scientific evidence suggests that if young people start smoking or using marijuana early, that they can have some cognitive losses. But that depends on when they start, how young they start, how much they use it, and when they quit. So if they've used it all their lives, well, then they've shown that there's a decrease in cognitive development. But then if adults start using it, well, then this decrease in thinking and memory and all has not been shown. So I'm saying that there are definite effects of any medicine, and our response. It has to do with our thinking, our memory, our response. And let's say that, but if we said that, nobody would ever take another drink of alcohol. Right. We don't prescribe. I'm not saying alcohol is a medicine, but sometimes I say a glass of wine every night, might be good for you. But this is a little bit different but I feel that for the doctors who feel that this drug is a benefit to their patients, just because we've not done the research. And nothing kills patients. Aspirin has killed more people than almost any medicine we've got out there.
Let me ask you quickly, for older people in particular, is there any risk of medical marijuana interacting in a negative way with other medicines, or perhaps making those medicines less effective?
Well, part of the reason, and Dr. Elders touched on this, we don't have an extensive amount of research. And the fact is that the products that are being ingested and smoked in Colorado have very high THC contents. And we've never had a large population of people ingesting large amounts of these high THC products. So we don't really know. Anecdotally, there's a lot of things going on. And Dr. Elders sort of took my talking point here with the cognitive deficits. There is a very tight correlation in the medical literature that says that adolescents who are using at least once a week have permanent cognitive deficits, and it never recovers. And in addition to that, when you look at some of these states where young people are smoking, there's a growing body of anecdotal literature and medical research showing that THC actually interferes with testosterone, and that there are young men who are developing breasts and having to go get liposuction for breast development because they're smoking marijuana and these high THC content joints and eating these products. So there's a lot of different things. It exacerbates psychiatric problems. It rewires the brain if you're smoking under the age of 25 habitually to make you more prone not only to dependence on marijuana but to other substances as well. So look, if someone who's an adult wants to say, I want to treat this like alcohol or I want to treat this like cigarettes and I understand the risk, that's one thing. But both Issue 6 and Issue 7 allow adolescents to get medical marijuana cards and use medical marijuana. And in addition to that, in Colorado, 74% of the kids in substance abuse treatment programs use someone else's medical marijuana, and they use it on average 50 times. So the adolescent use is a big, big problem, and it has definite negative effects on populations, and people need to realize that.
Okay. Our thanks to both of the good doctors. We appreciate you being with us tonight. Roby is standing by. Roby, I think you've got some additional comments and questions that we've heard from our viewers. What are they saying out there in the Facebook land tonight?
I got a few here, and so I want to start with one from Adam Fontenot, I think is how you pronounce that. What is the difference between Issue 6 and 7? I'm going to ask our folks in the control booth to pull up our two slides once again that explain what Issue 6 does and explain what Issue 7 does. Issue 6 is the Arkansas Medical Marijuana Amendment of 2016. It allows a person to receive an Arkansas doctor's certification that they're suffering from a medical condition allowed for medical marijuana usage. The doctor's certification allows a person to apply with the State Department of Health in order to receive an ID card, and with that card, a person could purchase marijuana for medical purposes at one of the limited dispensaries allowed by law. And there's 17 specified qualifying conditions in the amendment proposal. On issue number 7, the Arkansas Medical Cannabis Act, it would, like the amendment, it would require the doctor's certification, an application for an ID card at the health department, an ability to buy a limited amount at a dispensary. It also has a hardship certificate in it that if you don't live close enough to one of those dispensaries, you can grow your own cannabis plants in a limited quantity. There are more conditions allowed for medical marijuana under the Act, including all of those ones that were mentioned, that I mentioned earlier in the show on the amendment, but there's quite a few more that are allowed in there. So a couple more comments that we have here from Georgianne Smith. She says, good point, Dr. Elders. This was from earlier when she was talking about jails are full of people who don't need to be there. The war on drugs is a farce and a failure. Melissa Rackers asked why the government should be allowed to legislate a plant. Perhaps a question for your guest that you're lining up there. And then lastly, could Rolanda Robinson says they couldn't get marijuana research funded because Big Pharma doesn't benefit from it. And I've heard that argument out there from some others about some of the studies that have not been done. So, Chris, you are back with Melissa Fults and Kirk Lane, and I am going to let you take back over.
Okay, Roby, thanks. And Kirk, I'll put that one question to you. Why should government be allowed to regulate a plant?
I think it's a difficult question for me to ask. I think there has to be some regulations when it comes to public health. You know, in 1924, the FDA was formed to give some consumer protection and protection to people to make sure that they were medicating or consuming products properly. And that's why it was formed, because before that it wasn't. So again, learning from our past and moving forward, those protections are needed.
Okay, we talked about some of the opposition and support, the Democratic Party supporting medicinal marijuana in theory, in general, I guess. Governor Hutchinson, Senator Bozeman opposing both of these ballot initiatives. This is the Bible Belt we live in. We know that. Is this really coming down to social conservatives battling a liberal progressive policy in Arkansas, or is it more than that?
I don't think so. As a matter of fact, the support that we have is across the board. It doesn't matter what political views you have, how conservative you are, how liberal you are, people support it. And I'll tell you when they support it. Even the conservative people who are, oh no, we can't do this. What happens is a loved one of theirs is in a position where this can help them, and suddenly their whole attitude changes. It's different when it affects you personally. So I don't think it has anything to do with what political party you're with. I think it has to do with people who are educating themselves about it and realizes this truly is a medicine and that people should be allowed to have it.
Okay. I need to introduce these gummy bears that Kirk brought back into this conversation. There are THC-infused edible products that would be a part of dispensaries in Arkansas. People do worry that their kids could get a hold of this. What do you do to make sure that's not something that happens?
For the most part, parents are going to treat this just like they do any other medication that they have. Unfortunately, sometimes children do get into the medication. I myself, when my daughter was 2 years old, I had a top chest of drawers. I set her Tylenol up there. She opened up the drawers, made little stairs, got up there. I walked in. She was supposed to be taking a nap, and she was finishing off the bottle. Tylenol is more dangerous than what they would get with these gummy bears. With these gummy bears, I have talked to too many doctors and too many people in other states where it's legal. They do go to the hospital because the parents are afraid, and a good parent would take their child. My child has taken this. Usually one of two things happen. They either get sick and throw it up, or they get sleepy, they go to sleep, they get up, then they go home. Unlike if they overdose on the Tylenol, she spent 24 hours in the hospital, and they were concerned that she would have permanent liver damage. But as far as candy-flavored medication, Adderall, and another company that has Adderall, which is an amphetamine, which they give children for ADD, now comes in a fruit-flavored chewable. You hand those to those kids, and the kids eat them every day. So the kid's going to go, oh, this is really good. What's going to happen if they get a hold of those? They die. Parents are careful. They try to keep their medication up. Leaving this out would be like leaving hydrocodone out. Parents don't do that. Do accidents happen? Unfortunately, yes. But at least the child's not going to die.
Okay, some other concerns that are involved with this legislation. Some business owners are concerned it would create a hardship for them in an effort to maintain a drug-free workplace. How do you answer that criticism?
In our initiative, and this has been one of the opponents' biggest thing is, oh, the employers can't get rid of employees. We very clearly state in here that you cannot be using it on the job. And I'm sure that Chief Lane will tell you, if somebody's high, you can pretty much tell that they're high. So you're not going to go to work high. You're not going to, and most patients are not doing it to get high. They're doing it to get well. You talk to a cancer patient or a Crohn's patient or an MS patient. Are you doing this to party? Trust me, they're not partying. They're trying to alleviate their pain.
Issue 7 has considerably more conditions covered than Issue 6. And some people think that with certain conditions that are in there, like restless leg syndrome or insomnia, that does kind of open the door for almost anyone who wants marijuana, whether they're using it recreationally or medicinally, to get their hands on it. How do you deal with that?
Okay, the reason that we added so many more qualifying conditions is because different studies have been performed and are being performed in other countries on these different things. Restless leg syndrome and even migraines. A lot of people don't realize migraines is the 6th most debilitating illness in the world. And they are doing studies and showing wonderful results with patients with migraines, that it actually alleviates their migraines, helps them be able to function. And with the restless leg syndrome, we have seen firsthand patients that, everybody thinks, oh, restless leg syndrome's no big deal. It is a big deal. When you spend, as soon as someone goes into rest with restless leg syndrome, their legs start jerking. Many people feel like there's ants biting them. It's stinging and hurting and a pain. They don't sleep at night. They're exhausted. And you know as well as I do, people have to rest for their bodies to recuperate. And the medications are dangerous that they give them for restless legs. They're narcotics. And they can cause a lot of serious side effects. And I have seen firsthand patients that have gone from their restless leg medicine to eating, say, a cookie before they go to bed, and they sleep all night long. Their legs, the cannabis is a natural muscle relaxer, and it's a natural anti-inflammatory, and so their body relaxes and they actually get to have the rest that they desperately need. Why should we deny these patients? Why should we deny a migraine patient or a person who cannot sleep all night long and take very heavy, harmful drugs? Why should we deny them a chance to use a medication that is much safer? And I'm sure he'll agree with me. Narcotics are horrible. They have terrible side effects. Why not allow these people to have the same option as a cancer patient?
Chief, I know another unique part of Issue 7 is the fact that it allows patients who live a certain distance from a dispensary to grow their own marijuana at home. From a law enforcement point of view, what do you think of that?
I think it's a tough regulation because how you serial number a plant, other than sticking a cord through it and adding a tag to it in some capacity, is going to be difficult to regulate. And that's one of the difficult things that, or one of the objects that we are looking at on what Colorado does and what Washington does, trying to learn from those states that have been labeled the guinea pig states, so we can learn from that the pros and cons. And with that, there has been significant evidence that come on pesticides and different things that are put on there, and because of it's not controlled by FDA or any consumer protection type aspects, really opens the door of the quality and assurance that a consumer may get of that type plant. And what do you do when you get bad medicine? Or if you have a prescription, you have some regulatory, you have some studies that are on there, but on marijuana, you really don't, because it's not tabulated and not a pure science. And I think that's one of the things that that comes out of it. if it was vetted by science, we would be very supportive to it. And it was approved by the FDA, we would be very supportive. Recently I sat in both nationally and locally with a group of police chiefs and law enforcement CEOs in those capacities, and the question was posed to us: if it was vetted by science, if it was approved by the FDA, would you all support it? And everybody in there raised their hand. Everybody in the room, 100% raised their hand. So that is, to me, one of the big components of this, that it needs to be there, and people need to be protected, just like the milk you drink or anything else that you put into your body needs to be vetted by science.
A lot of people believe that this lost in 2012 because of that grow your own provision. Why is it back? Why is it that important?
Because I don't believe that was a factor. We lost 1.75%, mostly because people were not educated. We didn't get out and do our jobs to educate people. Most of the extensive polls have shown just the opposite. It's not a problem. And as far as how are we going to regulate it, they will be regulated just like the care centers. And in other states, they do have electronic labels on the plants. You have to be able to show each of those plants, and they have to match those numbers. I don't want it to get out. I don't want my granddaughter to have access to it. I don't want her friends to have access to it. But as far as the safety of it, that's one reason why Issue 7 wrote in there that they have to have testing labs here. They have testing labs in several of the other states. They test to make sure there's no pesticides, to make sure there's no dust mites, to make sure of the levels of the THC, of the CBD, and all the other components. And as far as another of the things of the candies, the health department is going to have a big part in how these are labeled. And I've had a restaurant before, and the health department is very thorough. And I have full confidence that they can set the regulations that need to be set to make these things safe. So there will be ways for us to check if somebody does grow it. And as far as how many people grow, there's not going to be a lot of people that will be allowed to grow. It is more than 20 miles from a care center. And they will also be subject to random checks, no pre-notification. They go to the door, I want to see your grow area, so that people don't have a chance to hide it.
I would disagree on that very heartily. From a law enforcement aspect, every day across this nation, interdiction officers that work the highway are finding marijuana plants, marijuana that came from Colorado and Washington that have these restraints, California, these different states that have legalized marijuana in one capacity or the next. They're finding them on loads that are coming in here. They have thwarted the systems that have been set up, and they're coming in and being sold because there's no taxing of it, and it's sold for a higher quantity. We're seeing it on the streets of Arkansas. We make cases every month that come into the highway in our communities, and the total THC level of marijuana, where we used to be seeing 6 or 7, is now risen to 15 to 20. And that's affecting our children, and it's affecting the black market and everything that's involved in that. In those states themselves, Colorado and Washington, cartels have moved in there, and it's become a perfect storm because it's a cash business. And so there's a lot of questions and problems dynamically of crime and public safety that is mixed into that. And yeah, they can say they're regulating it, but it's being thwarted, the regulation. Nebraska, Oklahoma, and other states have major lawsuits now against Colorado because of what that stuff that they're supposed to be controlling is coming into those states.
Okay, you bring up taxation. Melissa, just today, DFA claimed that both proposals on the ballot would generate $2.5 million a year in new tax revenue, but they say both would be outstripped by the costs of enforcement, that each proposal could cost as much as $5.7 million to administer, minus the expected revenue. Are those numbers correct?
I don't think they are. Of course, Asa Hutchinson is very much against this, so everything's going to be skewed to go against us. I mean, that's just, we expected it. But I want to use Arizona as an example. Arizona is set up much like our taxation and set up to run the program. And Arizona, the first year, had 1.3 million excess in funds to run the program. I just cannot believe that it will take that much more. 25 other states have done this. 25 other states have managed to run these programs basically the same way we're going to run it. And they have plenty of funds. It has not cost the state.
Okay. Our thanks to both of you. We're approaching the end of our hour-long discussion tonight. Let's go back over to Roby for one last look at the pros and cons of medical marijuana. Roby?
All right. Thank you so much, Chris. So we are coming to the end of that hour-long discussion here. Remember, you're going to be voting on the ballot. These will be issue number 6 and issue number 7. I want to give you a great resource you can go to for some nonpartisan information on this. It is uaex.edu. If you'll go to that website and search for, you'll see it on the homepage there. It's Voter's Guide is what it's called. It will give you a lot of nonpartisan information, a lot of detailed information about all of the things that are in issue 6, issue 7, many questions that we didn't even get a chance to visit about tonight, Chris. But it's a great resource for folks to learn a lot more about what's going on in these 2 measures.
Okay, and this has been a great program. We appreciate you helping us make it happen. It's our goal to have your questions answered as we move toward Election Day on November 8th. It's just around the corner. We're going to plan to have several more of these events before Election Day, so we hope you join us for that. And we thank you all from here at Channel 7 and our partners at Talk Politics, Talk Business and Politics.
I want to give a shout out to Melissa Fults and Dr. Greg Bledsoe and Kirk Lane and Dr. Joycelyn Elders. They did a great job. And we got some tremendous traffic tonight on Facebook, Chris. Well over 1,200 comments and questions came through. You channeled through some, we channeled through some. There's just a lot of great information there. So looking forward to doing more of this.
All right, fantastic. We thank you once again. We hope you're an informed voter as you go to the polls on November 8th. Good night.